My name is Chelsea, and today this video is for the NG tube insertion. First thing I'm going to do is ensure that the patient has privacy, close the door, introduce myself, let the patient know that I'm the nurse who will be inserting the NG tube today, get my two patient identifiers, first and last name and date of birth, and then I would perform my hand hygiene. So I'm going to get my gloves on. Let the patient know that the doctor ordered this NG tube to relieve some pressure. We'll be doing this for suctioning. All right, perfect. So first thing I'm going to do is use my pen light, look in each nares to see if there's any obstruction or lesions or anything that would interfere with me inserting the NG tube. And then I'm going to have the patient, I'm going to occlude one nostril, have them breathe in and out, and then occlude the other nostril, breathe in and out. All right, perfect. And I do have the patient also in a high Fowler's position. So both nostrils seem fine. I didn't see anything abnormal, but I'm going to go ahead and use the right one. So I'm going to place my tubing inside the warm water. And while we're waiting for that, I'm just going to show that I have my lubrication right here. I have this chuck right here to put for patient in case they gag or it gets messy or anything. So I'll put that right there. I have a pin, or you can use tape to tape or secure the tubing to the patient's gown, and then I have a piece of tape here that I prepared already. I have my syringe for when we aspirate the contents, and then also a cup just in case they need to take some sips if they do begin to gag. So the first thing that we want to do is measure. So we would go from the tip of the nose to the ear down to the xiphoid process. And for this patient, it's going to be at 50. And we want to keep a mental note of that for documentation purposes. So I'm going to go ahead and lubricate the tip. Let the patient know that this is a very uncomfortable procedure, and that if at any point they do get uncomfortable, to just go ahead and raise their hand so that we can pause and take a moment before we proceed. So just gonna tilt the patient, have them tilt back just a little bit and slowly insert, and just continue to insert. Now, if I did meet any resistance, I would have to stop and start the whole process all over. But there's no resistance. Patient's tolerating it well, so I'm going to continue. Okay, my patient's starting to gag, but I do have the water here, and I'm going to encourage them to sip the water. And then I'm going to continue to advance the tubing about 5 to 10 centimeters. And then have them take another sip, advance it 5 to 10 centimeters, another sip, advance it another 5 to 10 centimeters, and then I've gotten to my 50 mark, so I'm going to go ahead and tape it, and then wrap it around, wrap this part around as well. And then really important, we want to aspirate the contents, and we're going to put it on a pH test strip just to ensure that we're in the right spot. Then I'm going to go ahead and get about 10 ml, put it on the pH strip. It looks good. So we're still going to order a chest x-ray to ensure that the tubing is in the right place. I have my safety pin here. I'm going to go ahead and put the safety pin here to attach it to the gown. Now that my patient has come back from the x-ray, it does show that we are in the right spot. If we weren't, we would have to, again, start all over. If the pH also came out abnormal, we would have to start all over. So then I would place the patient back down in a low Fowler's position, and then I would also attach this to the suction as well. And then I would remove my gloves, perform hand hygiene, and then I would document the depth of the tubing. So that 50 centimeters mark, we would need to document that in the chart, how the patient tolerated it, the characteristics and contents. When I aspirated, if there was anything abnormal, I would notate that all in the chart. Getting the chest x-ray, noting that it came back that we were in the right position, and then just maintaining patency. And that's it.